Hello, everyone. My name is Dr. Garrett Smith, and I'm known as the nutrition detective. Just wanted to make sure everything was set there. So what we're going to be going over today is we're going to be going over how, based on the research, vitamin K deficiency, or K2 if you prefer to call it K2, I'm just going to say them all as vitamin K, is caused by the thing we call a vitamin A. What we're going to go over is how vitamin A depletes vitamin K, and how that lack of vitamin K that is present then allows the vitamin A to do more damage. So here we go. Vitamin K in recent years, has been called a wonder nutrient, and people are supplementing megadoses of it, way more than they could ever get from food. That should make you wonder why. Why didn't people in the past have to do this? What's going on now? Well, what if there was an evidence-led cause for this, quote, epidemic of deficiency among people? The main purposes of this presentation that we're going to go over today, there are two of them. We are going to show how it has been demonstrated in multiple studies that multiple different types of the, quote, vitamin A, and I abbreviate it vitamin A through, or VA as vitamin A through this presentation, have been shown to deplete vitamin K. And we're also going to show how many of the diseases said to be helped by vitamin K, or that are caused by a vitamin K deficiency, and that benefit from supplementation, are already known to be problems caused by vitamin A in the research. First, we're going to cover some important foundations established in other videos. And if you want to keep your chemistry card up to date, you need to realize that when we're talking about chemical compounds, they're the same. Once they talk about 13-cis-retinoic acid, whether you take it in a pill or whether it's in your body, it's the same compound. This is a big thing. Number one, nearly all vitamin A that one consumes, whether they're eating it or rubbing it on their skin, eventually turns into retinoic acids. The exceptions are fairly few and far between, but there are some. The retinoic acids that the body creates, that your body creates in the detoxification, also known as the biotransformation process of vitamin A, includes 13-cis-retinoic acid, which is the same compound that's called isotretinoin, also called Accutane. It also makes all-trans-retinoic acid, which is also known as tretinoin, also known as Retin-A, and 9-cis-retinoic acid, which is also known as alitretinoin. I have a link there for the whole video. Just so you know, this whole Google Slides presentation is going to be available for anybody to see on the internet. It'll be put down in the comments. And it's there. So all these references, all these hyperlinks, you can go and check them. I'm not hiding a thing. I have a whole video going over how the body turns vitamin A into these retinoic acids. And these retinoic acids, there is no difference between them synthetically or naturally. A chemist would not be able to tell you whether they were looking at a natural retinoic acid or a synthetic retinoic acid if they have the exact same molecule in front of them. You must know this. To argue otherwise is not scientifically backable, defendable, okay? Number two, there is no difference in the effects on the body between natural forms of vitamin A and synthetic forms of vitamin A when we're talking about the exact same compound. We're talking about 13-cis-retinoic acid that your body made, and we're talking about 13-cis-retinoic acid that is put by a pharmaceutical company into a pill. They are exactly the same compound. So again, I linked the video again. You can go over and you can go and see more of the research. I'm trying to save some time here. You can go and see the research, how this all ties together in that other video. And I'll even cover it here a little bit again. So next, what is vitamin K and why is it important? This video is not meant to be a whole video about vitamin K. I'm assuming if you're here, you've probably heard of vitamin A. You think it's really important. You may think it's going to save the world. Well, if we stop depleting it first, that would probably be a good thing. I'm going to keep the vitamin K definition here simple. Vitamin K is a group of fat-soluble vitamins. Broadly, they direct calcium and allow the blood to clot. It's very important that you realize they allow the blood to clot. They don't make the blood clot. This is like saying gasoline allows you to drive somewhere, but gasoline doesn't force your car to drive anywhere, okay? This is a very important analogy. It's not, people think vitamin K is going to give them blood clots. No, it doesn't do that. So why is vitamin K important to the body? So I got this quote from the book, Vitamin K2 and the Calcium Paradox, How a Little Known Vitamin Could Save Your Life. And this is a blurb on their sales page for it. Quote, without vitamin K2, the body cannot direct calcium to the bones where it's needed. Instead, the calcium resides in soft tissue like the arteries, leading to a combination of osteoporosis and atherosclerosis, or the dreaded calcium paradox. This is the first book to reveal how universal a vitamin K2 deficiency is and the risk in the form of cancer and diabetes, among other ailments, the absence of vitamin K2 poses. Written by Dr. Kate Room-Blue, a popular health expert on Canadian television and radio, vitamin K and the calcium paradox sounds a warning about the popularity of the calcium and vitamin D craze, while illustrating the enormous health benefits of vitamin K2 and making the body less susceptible to dental cavities, heart disease, prostate cancer, liver cancer, diabetes, wrinkles, obesity, varicose veins, and other ailments. End quote. Okay, we're going to come back to this whole quote again later. And I highlighted the diseases that they talk about here because we're going to link these all to vitamin A in the diet and vitamin A toxicity and how these things deplete vitamin K. So here we go. What if nearly all of the symptoms of vitamin K deficiency were also symptoms of vitamin A toxicity? So let's correlate the two things in as many ways as we can, shall we? Does vitamin A induce vitamin K deficiency in the research? Yes, it does. From the paper, Mechanism of the Effect of Retinoic Acid and Squalene on Vitamin K Deficiency in the Rat. Quote, the anticoagulant effect of squalene and retinoic acid was studied in adult male rats fed purified diets deficient in vitamin K. They got none. Both appear to inhibit absorption of vitamin K, although possibly by different mechanisms. On this basis, indigestible oils and retinoic acid may be useful agents for the production of simple vitamin K deficiency in mammalian species. End quote. That seems pretty straightforward, right? Let's go to the next paper. More evidence of vitamin A depleting vitamin K. From the paper, Effect of Indigestible Oils on Vitamin K Deficiency in the Rat. Quote, studies of indigestible oils such as mineral oil and squalene were undertaken to determine their effect on vitamin K deficiency in the rat. Severe hypoprothrombemia occurred in male rats fed a vitamin K deficient diet containing as little as 0.5% of the oil, and the effect was reversed by feeding vitamin K. Female rats were partially resistant to the treatment. Dietary squalene also interrupted the assimilation of vitamin K in chicks, where 0.5% of dietary oil inhibited the utilization of 0.1 microgram of phyloquinone, that's vitamin K1, per gram of diet. Similar results were obtained in chicks fed retinyl acetate and retinoic acid, end quote. Okay, so that last sentence is the most important part. Similar results were obtained in chicks fed retinyl acetate, which is a retinyl ester, which is a type of vitamin A that your body stores in the liver and in the body fat. Retinyl acetate is totally synthetic, but the most common retinyl ester in your body is retinyl palmitate, which is what they sell as supplements, and is what is in the cod liver oil you might still be taking, if you haven't seen my video on cod liver oil, or is in the liver, the main retinyl ester that's in liver that you might still be eating. If you haven't seen my video about how eating liver can actually kill you and send you to the hospital, and I have tons of different livers from different animals showing these case studies that people were poisoned in one feeding of liver. Okay? So what they're saying, similar results were obtained in chicks fed retinyl acetate and retinoic acid. Retinoic acid is the same stuff chemically when you eat vitamin A and your body turns it into retinoic acid, or when you take it in a pill. I'm going to repeat this over and over. So severe hypoprothrombemia. Severe hypoprothrombemia, low prothrombin in the blood. What this does, you got to understand this, it increases the prothrombin time, which basically means you're slower to clot. So low prothrombin means it can't clot as well, and that means increased prothrombin time. They're measuring how long it takes to clot. So I want to get that straight at the start. So a vitamin K deficient diet caused this hypoprothrombemia, increased prothrombin time, slower clotting. And it was reversed by feeding vitamin K, Squalene interrupted the vitamin K, just like it did in the other study. And then they're seeing similar results in rats fed vitamin A. Do you get that? They gave them a vitamin K deficiency. They got certain effects, and then they gave them vitamin A, 2 different forms of vitamin A, and they got similar effects to a vitamin K deficient diet. Okay, this should be getting clear. This should be getting clear now. Now, this is a really big paper. We're going to review some stuff first, and then we're going to dive into what I call the big paper, where we're going to be for a lot of this presentation. So first, again, I have that video I talked about earlier where I go over how your body turns all vitamin A you eat into retinoic acids, which are the same compounds as Accutane, Retin-A, alitretinoin. And I have that video linked. I'm just going to review it real quick here. So from the paper, 13-cis-retinoic acid is an endogenous compound in human serum. Quote, the presence of 13-cis-retinoic acid as the predominant form of retinoic acid in human urine under normal physiological conditions recently has been reported. End quote. So let's go through the key terms here. 13-cis-retinoic acid, endogenous. Endogenous means created within the body. Okay. 13-cis-retinoic acid is Accutane. It is isotretinoin. It is Roaccutane. It is the same compound. Endogenous means you create that within your body, and they're saying in human serum, which is your blood. And they're also saying it's the most common form of retinoic acid in human urine under normal physiological conditions. This means these people were not taking Accutane. Normal physiological conditions, normal diet. They're eating vitamin A foods. They are peeing out. They have Accutane in their blood, and they have Accutane in their urine. Okay? You cannot say these compounds are different. No one can argue that these compounds are different. Some people seem to think that you actually need 13-cis-retinoic acid because you need retinoic acids. That's what vitamin A turns into, and you need it, and it's a vitamin. But then again, Accutane is one of the most damaging drugs that's ever been out there. Just wait for my autoimmune video. If it's out by the time you see this, go watch it. Accutane, isotretinoin, 13-cis-retinoic acid, which is in your body under normal conditions if you eat vitamin A, has been shown to cause autoimmunity in every single body system. Case studies on every single one of them. You're going to be amazed when I do that video. Now, next review. Research shows that natural vitamin A causes the exact same problems as synthetic vitamin A. From the paper, a review paper, a big review paper, we're going to cover this one again later. Vitamin A intake and osteoporosis, a clinical review. Here's the quote. I took a short quote from it. Total vitamin A intake is more important than source in determining harm. End quote. Let me read it again. Total vitamin A intake is more important than source in determining harm. People are still going to want to argue that somehow natural vitamin A can't hurt you and synthetic vitamin A can. And they have no feet to stand on. Nothing. Nothing in the research backs up what you say. I am sorry. And maybe this is why if you've been eating lots of high vitamin A foods and taking your cod liver oil or eating your liver or doing carrot juice or eating tons of brightly colored vegetables and your health is getting worse, maybe you've been eating lots of sweet potatoes and your health is slowly getting worse and you're getting more and more conditions, maybe you might not want to believe that these two things are different, that somehow natural is safe and protective and synthetic is bad. They are the same chemicals. They cause the same reactions in the body. Let's be smart here. So from the big paper, this is the big paper now. The paper is called Mechanism of the Effect of Retinoic Acid and Squalene on Vitamin K Deficiency in the Rat. First quote, the recent increase in the clinical use of synthetic vitamin A compounds has led to concern of possible side effects. That's a good thing. Some of these effects are known to be influenced by dietary levels of vitamin K. So we've just shown with multiple papers that vitamin A, retinoic acids, and vitamin K are connected. Okay? We know they're connected. I just showed you that from the research, natural vitamin A compounds act exactly the same way in the body as their synthetic counterparts. Okay. They're saying the clinical use of these things is going up, leading to concern of possible side effects. Well, what if tons of people are getting side effects of this poison every day? And one of them is a vitamin K deficiency. Moving on. Again, more from the big paper. Quote, systemic administration of large doses of vitamin A induces a series of effects known as the hypervitaminosis A syndrome. These effects include bone fractures, hemorrhaging, calcification of internal organs, lipid and liver alterations, and hair loss. Almost all of the adverse side effects described thus far in laboratory animals have been reported to occur in humans. Let's just stick on that for a second. Vitamin A, toxicity. Bone fractures. Is osteoporosis mentioned in the vitamin K2 thing earlier? Yes, okay. Hemorrhaging. Wait, were we talking about increased prothrombin times, decreased clotting caused by vitamin A earlier? Decreasing vitamin K, yeah. Calcification of internal organs. Did they mention atherosclerosis, which is actually calcification of your arteries? Yeah, they mentioned that. Lipid and liver alterations. Is there a problem with people with high triglycerides and high cholesterol these days? Did you know that actually retinoids are built into the cholesterol molecule? LDL, VLDL, HDL, they all have different types of vitamin A in them. Isn't that weird? If there was a vitamin A toxicity epidemic and the body forced vitamin A forms into cholesterol, that would explain why it's gone up, right? Hair loss, big concern for people these days. All these things have happened in rats from too much vitamin A. And then you have yahoos out there saying that we're all deficient in vitamin A. There's a massive retinol deficiency and all of our problems are from lack of it. I gotta say, I don't agree. Next part, quote, we observed that male rats developed a tendency to bleed when they were fed for a prolonged period of diet containing 13-cis-RA, retinoic acid. Others have reported that retinoid-induced hemorrhaging could be reversed by vitamin K administration. So again, remember, we make 13-cis-retinoic acid from any vitamin A that you eat. Tendency to bleed. Know anybody who's got easy bruising? Their cuts don't stop as quick as they think they should? What does warfarin do? Coumadin. It's a vitamin K antagonist. What does it cause? It causes hemorrhaging. It causes easy bruising. Okay. Here's the good part. Retinoid, vitamin A, induced bleeding, lack of clotting, like way too much bleeding, excessive bleeding, could be reversed by vitamin K administration. So they gave him vitamin A and then they gave him vitamin K and they fixed the bleeding problem. Wow. Weird. Next part, quote, depletion of vitamin K results in a reduction of carboxylated clotting factors and an in-associated hemorrhaging. The observed hemorrhaging, therefore, may occur through interference in vitamin K availability or metabolism. These observations, along with reports of increased prothrombin times and epistaxis, nosebleeds, in patients receiving retinoid therapy, led us to investigate the effects of dietary vitamin K on retinoid-induced hemorrhaging. End quote. So they got these terms multiple places, retinoid-induced hemorrhaging. Okay. Increased prothrombin times, nosebleeds. They're probably talking about spontaneous nosebleeds. People just nosebleeds out of nowhere. Okay. We're just going to move on. That says enough. Again, from the big paper, quote, we therefore compared the toxic effects, the toxic effects of 13-cis-retinoic acid, retinol acetate, and N4-hydroxyphenylretinamide, or 4-HPR, in male Sprague Dawley rats maintained on diets containing different levels of vitamin K, end quote. So they are comparing the toxic effects. They specifically said the toxic effects of a retinoic acid that is actually found in your body, the predominant endogenous form of retinoic acid found in the urine, and it's also in the blood, from when people consume any vitamin A, pretty much. They're comparing that with a synthetic retinol ester called retinol acetate. We already talked about retinol esters like retinol palmitate are actually what you are eating when you eat cod liver oil, when you eat liver. This is what animal vitamin A is when you eat it in tissues. It is not retinol. Retinol is like a couple percent. It's almost all retinol esters. So if the people who are telling you that you need to eat more retinol in your foods don't even understand that what is in foods is mostly, nearly all, 90-something% retinol esters, how much are they maybe not aware about vitamin A metabolism and then therefore about vitamin A toxicity? Okay, but retinol acetate is completely a synthetic form of vitamin A. I'll give you that. And they're comparing it also to a synthetic retinamide, totally synthetic, that is used for chemotherapy. Wow. How many other vitamins do you know that are used as chemotherapy? Chemotherapy is generally a term reserved for things that are pretty darn toxic, right? Chemotherapy. Nobody thinks of that as a vitamin. But if birds of a feather flock together, and you're saying there's forms of vitamin A related compounds that can be used as chemotherapy, what does that say about the other types? Did you know 13-cis-retinoic acid, aka isotretinoin, aka Accutane, naturally found in your body, has been used as chemotherapy? Go to a website called chemocare.com. Look it up. Do you want to be eating chemotherapy on a daily basis? Do you think that's a good idea? Some people say, oh, well, it will prevent cancer. Chemotherapy never prevented anything. Chemotherapy is what killed my dad on the 5th round of treatment for his prostate cancer. Before I knew all this, before I could have really helped him. So anyway, and they gave these retinoids to rats with varying amounts of vitamin K in them, okay? Next quote, animals were fed either an NIH-07 diet supplemented with menadione, which is vitamin K3. This is the first diet, right? The NIH-07 diet specifics, I have a link for those if you want to look it up. Here's a quote from a company that sells it. Quote, the rodent NIH-07 open formula diet is formulated for reproduction and lactation of both rats and mice. It has been used at the National Institutes of Health as the standard reference diet for biological and biomedical research, end quote. Okay, so it's a diet that gets the rats through their lives. Okay. It contains both vitamin A and vitamin K, a little bit of both of those in the standard amounts. Kind of like if you think of dog food. Dog food has a certain amount of vitamins and minerals in it. That's what they're doing here. It has vitamin A in it, has some vitamin K. Now, on the next slide, we're going to discuss the phony vitamin K called K3 and poisonous vitamin K, K3. We're going to go over that now. So we're taking a little break from the big paper. What is menadione, aka vitamin K3? This is from a website called The Controversy Over Menadione in Dog Food. It appears that menadione is quite problematic, and this has been known for a long time. Quoting the website, according to a peer-reviewed article published in 2004 by the Linus Pauling Institute at Oregon State University, and this is quoting the Linus Pauling Institute, although allergic reaction is possible, there is no known toxicity associated with high doses of the phyloquinone, vitamin K1, or menaquinone, vitamin K2, forms of vitamin K. The same is not true for synthetic menadione, vitamin K3, and its derivatives. Menadione can interfere with the function of glutathione, one of the body's natural antioxidants, resulting in oxidative damage to cell membranes. Continuing on that. Menadione given by injection has induced liver toxicity, jaundice, and hemolytic anemia due to the rupture of red blood cells in infants. Therefore, menadione is no longer used for the treatment of vitamin K deficiency. No tolerable upper level of intake has been established for vitamin K, end quote. I want to go on that last sentence for a second. They mean vitamin K1 and K2. No tolerable upper level of intake has been established for vitamin K. So what they're saying is they don't know how much vitamin K you could take, K1 or K2, before you get a problem. What they've already found is that menadione given by injection, who do we give vitamin K injections to? Isn't that infants, newborns? They were giving this poisonous vitamin K to newborns. Liver toxicity, jaundice, and hemolytic anemia due to rupture of red blood cells. Wow. So I'm going to finish this quote from the website. The FDA has banned the use of menadione from over-the-counter supplements because large doses have been shown to cause these dangerous biological effects. Okay. So isn't it kind of amazing how what should have been obviously discovered quickly or never even, it should have been discovered quickly to be a poison or never even used, was allowed and encouraged to masquerade around as a vitamin? And we're still feeding it to our pets with all we know? Do you actually think that the nutrition powers that be are out to protect you? I can't imagine this possibly happening anywhere else with any other vitamin. Oh, wait. Oh, we're talking about vitamin A toxicity. Oh, that's right. They might have made a mistake there. And if you read some of my other stuff about vitamin D supplements, and if you learn that vitamin D3 is sold in blocks called Tetra blocks, B-L-O-X, Terra D3, T-E-R-A D3, Terra D3 blocks, B-L-O-X. Look up Terra D3 blocks. It's rat poison that is vitamin D supplement. They take your vitamin D supplement, they package it up in a little block, and they give it to rats. And you know when they give the rats this vitamin D3 poison? They give it to them when the Coumadin or warfarin blocks stop working. Vitamin D3 is another level poison for the rats. When the Coumadin and warfarin stops working or doesn't work on the rats, you move up to the D3. And you might be taking this on a daily basis. Oh, you're taking cod liver oil, which contains vitamin A and vitamin D, and you're not getting better? There might be something to this. More on the big paper. Quote, an NIH 07 diet not supplemented with menadione. So this is the basic rat diet with the normal amounts of vitamin A and vitamin K in it. This is like the control diet, okay? Next quote, or an AIN 076 purified diet devoid of vitamin K, end quote. This diet has no vitamin K in it, none, okay? It's got the normal amount of vitamin A, no vitamin K. What we've been talking about here, vitamin A depletes vitamin K. They're giving them vitamin A and no vitamin K. Okay, quote, next quote. The retinoids had no effect on prothrombin times of animals fed the supplemented diet. When menadione was omitted from the diet, however, 4 HPR dosed animals had elevated prothrombin times. This effect was observed as early as day 7 and was accompanied by 1 confirmed hemorrhagic death. Okay, first sentence, the retinoids had no effect on prothrombin times of animals fed the supplemented diet. The animals that got the normal diet and the K3 didn't have any increased prothrombin times. Even when they got the fake, phony, poisonous K3, their bleeding, their coagulation time did not increase. Okay. When the control rats, the ones who got no menadione and the normal diet, I'm sorry, when menadione was omitted from the diet and they got the 4-HPR, the synthetic retinoid, they had elevated prothrombin times. Okay, so the K3 was preventing something that was caused by the retinoid. Okay, this effect was observed as early as day 7 and was accompanied by 1 confirmed hemorrhagic death. So 1 rat died from not enough vitamin K3, even when they gave them the normal diet, which had some, they got the normal amount of vitamin K in the diet, no extra K3, and 1 rat died and they showed coagulation problems at day 7. Okay, so vitamin K deficiency causes elevated prothrombin times. It increases how long it takes the blood to clot. That's what it does. Moving on. Quote, 13-cis-retinoic acid dosed animals showed no change in prothrombin times. End quote. Okay, well, that seems to go against what you're saying here, Dr. Smith. Okay, the study authors referenced a paper, and it might even be their own paper because they used the word "we" in it, that showed increased bleeding times in rats given 13-cis-retinoic acid. And this is back on a previous slide where they mentioned that. Here's the quote. We observed that male rats developed a tendency to bleed when they were fed for a prolonged period a diet containing 13-cis-retinoic acid, end quote. So we can assume that 13-cis-retinoic acid is also probably also affecting vitamin K somehow because they had tendencies to bleed, right? And then we had in humans, we were seeing increased prothrombin times from 13-cis-retinoic acid, and nosebleeds. Okay. Next quote, in the high-dose retinol acetate group, there was a twofold increase in prothrombin times, but only after prolonged dosing. Different forms of vitamin A can be stored at different rates. Retinoic acid doesn't really like to be stored very much. Retinoic acid is not your storage form. It just floats around. Retinol esters are the storage form. That's what you do with them. So it could take a little longer because you're taking more of a storage form. It takes a little longer to cause the effects. It still caused it. Okay. Next, in animals fed the NIH, sorry, I didn't say quote. In animals fed the NIH-07 diets, 13-cis-retinoic acid and retinol acetate induced multiple bone fractures at all dose levels. Induced multiple bone fractures at all dose levels. In contrast, 4-HPR administered at the highest dose induced only one fracture in one animal, end quote. So what's the biggest concern in osteoporosis, right? It's bone fractures. Oh, we'll come back to this when we read about the osteoporosis and vitamin A paper. But yeah, multiple bone fractures at all dose levels. And then the other one only caused one bone fracture. More from the big paper, quote, animals fed the purified diet, no vitamin K, lost weight faster and died sooner than those maintained on the other diets. Bone fractures were not observed in these animals because of early deaths resulting from hemorrhaging. For all retinoid dosed groups maintained on the purified diet, changes in prothrombin times occurred as early as 1 week. Okay. So they had animals given the vitamin K free diet. So they probably had a group that got no vitamin A. I mean, got none of the retinoids. So they were just deficient in vitamin K, but they still gave them vitamin A in their normal diet. The diet was only free of vitamin K. Okay. So we have vitamin K free animals plus a little bit of vitamin K. And then we have vitamin K free animals fed retinol acetate. We have vitamin K free animals fed 13-cis-retinoic acid. And then we have vitamin K free animals fed 4-HPR, the retinamide. They all died before they could break bones. 1 week before they showed clotting problems. Okay. Next quote. In conclusion, since increased prothrombin times and epistaxis, nosebleeds, in humans undergoing retinoid therapy have been reported, we suggest that persons receiving retinoid therapy be maintained on diets with adequate vitamin K, end quote. So it should seem pretty straightforward now that vitamin A, particularly once the body converts it into 13-cis-retinoic acid, depletes vitamin K. Have you ever heard of a dermatologist recommending vitamin K with their Accutane prescription? Roaccutane, isotretinoin, whatever you want to call it. Do they tell you to eat more vitamin K foods? They may even be telling you to, it's kind of funny because a lot of the high vitamin K foods are also high vitamin A foods. So if you start going and trying to eat a lot of high vitamin K foods, while you're dosing yourself with a bunch more vitamin A, as you're taking a synthetic retinoic acid, but again, it's the same compound that you make in your body, you might be in for a big problem. If you're not sure if Accutane causes big problems, just go on Facebook and look up Accutane like survivors and Accutane toxicity, and you'll find tons of groups with tens of thousands of members. What happens when you make that stuff in your body just from vitamin A you eat? But why don't, if this seems pretty clear that isotretinoin, 13-cis-retinoic acid, depletes vitamin K in the body, causes nosebleeds, these things, why aren't they recommending a vitamin K supplement or to eat more vitamin K in the food? So that we're done with that now. Now we're going to go into, do the diseases caused by vitamin A toxicity and vitamin K deficiency seem to match up? Well, let's go see. So now we're going to return to the calcium paradox disease list. Okay. So if there's a true connection between vitamin A toxicity and vitamin K deficiency, we should be able to see the same diseases come up for both, correct? So here we go. This is a quote from that blurb from the book. Quote, without vitamin K2, the body cannot direct calcium to the bones where it's needed. Instead, the calcium resides in soft tissue, like the arteries, leading to a combination of osteoporosis and atherosclerosis, or the dreaded calcium paradox. So, vitamin A has been shown to calcify arteries. I'm going to read the title of this paper. This is all I'm going to read because the title says it all. But I'm going to emphasize a certain part. Increased dietary intake of vitamin A promotes aortic valve calcification in vivo. Increased dietary intake of vitamin A. Increased dietary intake of vitamin A promotes aortic valve. The aorta is an artery. They're talking about soft tissue like the arteries, right? Calcification, calcium in soft tissues. Your arteries are supposed to be soft tissue. In vivo, that means in live animals, okay? So now that we just explained that, the link's there if you want to look at the paper. Now we go into retinol binding protein and atherosclerosis. The thing I'm going to say first before I go into this is retinol binding protein is something your body makes to protect you against vitamin A. Because retinol in the blood is extremely toxic. So it makes retinol binding protein to protect you from it because your body knows it's toxic. And if you go in the literature and you find out that when researchers see that there's too much retinol in the blood and not enough retinol binding protein, more problems happen. Scientists have also said that you can use retinol binding protein as kind of a surrogate or a stand-in test for vitamin A because your body doesn't make retinol binding protein without retinol around in the first place, right? You don't use your wrapping paper for presents until you have the presents around to wrap, right? So you don't make retinol binding protein until there's retinol around to wrap up. So if you see high retinol binding protein, it means that there's been more retinol around. Here's the title of the paper. Retinol binding protein 4 correlates with and is an early predictor of carotid atherosclerosis, hardening of the arteries, in type 2 diabetes mellitus patients. Weird, right? Atherosclerosis, retinol, dietary intake of vitamin A, calcification of the arteries. Okay, moving on. Does vitamin A cause osteoporosis and weaken bones? If you remember from that last slide, that was one of the things mentioned. From the paper, Vitamin A Intake and Osteoporosis, a clinical review. So this is a review where they're looking at a bunch of papers. Okay, quote, oral retinol palmitate in high doses induces fractures and radiographic osteoporosis in animals. Retinol intake from diet. Retinol intake from diet or supplements is negatively associated with lumbar, femoral neck, and trochanter bone mineral density, or BMD. There is a graded increase in relative risk of hip fracture with increasing retinol intake, attributable primarily to retinol either from diet or supplements, but not beta-carotene intake. Higher serum retinol levels are associated with higher risk of any fracture and with higher risk of hip fracture, whereas there is no evidence of harm associated with beta-carotene intake. The few randomized controlled trials involve serum markers of bone metabolism, not bone density or fracture outcomes. Observational studies are generally consistent in finding harm from either dietary or supplemental retinol intake on bone mineral density and hip fracture risk. Total vitamin A intake is more important than source in determining harm. Again, total vitamin A intake is more important than source in determining harm. Adverse effects may occur at a level of retinol intake that is only about twice the current recommendation for adult females. End quote. Diet or dietary mentioned 3 times. 3 times. Did you catch that? They didn't make a distinguishing note between dietary and supplements. No scientist is doing this. They're not finding that they can do that. They can't separate them. Multiple studies showing that total intake is more important than source in determining harm. Are you concerned about your bones? Do you know that the Scandinavian studies show bone density starts going down once you get above 3,000 units of vitamin A a day? Many of you are probably getting that at breakfast. And then you wonder, then what's at lunch and what's at dinner? And what's in your supplements and your multivitamin? And your superfoods. Oh, superfoods. Boy, those are not super. But all the YouTube ads tell you they are, right? So now the next part, the next ones that were mentioned, dental cavities, also known as caries, and heart disease. So here's the quote. This is the quote from the vitamin K2 book. While illustrating the enormous health benefits of vitamin K2 and making the body less susceptible to dental cavities, heart disease, prostate cancer, liver cancer, diabetes, wrinkles, obesity, varicose veins, and other ailments. End quote. Now, I'm not going to cover wrinkles and varicose veins because here's the thing, right? People take Accutane to help themselves with their skin, right? So it seems that when you heavy dose the skin with vitamin A, ooh, nice things happen to the skin while your insides are basically melting apart. Okay, here's an example. I had somebody who told me this. They knew someone who was using hair and skin products that are extremely high in carotenoids. Extremely high in carotenoids. And the woman was saying, oh, my hair is doing so great. My skin is doing so great. And at the same time, she developed lupus. Okay. But she didn't want to stop using the products because her hair and her skin was so great. But she gave herself lupus. Okay. So I'm not going to talk about the wrinkles and the varicose veins because people will say, I can find research that shows that using retinoic acid helps with wrinkles. That's cool. If you're all about the short-term vein superficial stuff and you're not worried about your insides basically getting eaten alive, you know what retinoic acid is used as? Go look up retinoic acid chemical peel. It's used as a chemical peel to, and I have the paper that says to induce controlled wounds of the skin. To induce controlled wounds of the skin. It melts your face off if you put enough on there. What do you think it's doing to your insides? Oh, but my skin is so much better. Cool. If that's all you care about, you want to leave a good looking, corpse in a coffin, go ahead, be my guest. And I'm not going to stop you. I'm just here to tell you stuff. Okay. So we're going to talk about the big ones. They're the things that will make your life suck or kill you. Dental cavities. First paper, and I have a link there to the first link where it says dental cavities. That's to my research forum where I go over more research than just these if you want to see more. The names of these papers pretty much give it away. Reduced salivary flow induced by systemic isotretinoin may lead to dental decay. A prospective clinical study. Dentists know that if you don't make enough saliva, you're going to get tooth decay. Seems that isotretinoin, aka 13-cis-retinoic acid, aka Accutane, causes you to make less saliva. And it did lead to more tooth decay in that study. Feel free to click on it. Next one for dental cavities, retinoic acid excess. Retinoic acid excess impairs amylogenesis, inducing enamel defects. You don't make enamel's the outer covering of your teeth, the shiny white stuff. You want that. That protects your teeth. Retinoic acid makes it so you don't make it as well. Okay, on to heart disease. This is a fun one. We kind of build up to the finale here. The paper, all trans retinoic acid induced life-threatening complete atrioventricular block. Okay, so an atrioventricular block or a heart block is when the electrical signal that controls the heartbeat is partially or completely blocked from reaching the ventricles, the heart muscles that pump, okay? Life-threatening complete AV block. That sounds like heart disease to me. Next one, reversible symptomatic myocarditis induced by all trans retinoic acid administration during induction treatment of acute promyelocytic leukemia. Rare cardiac manifestation as a retinoic acid syndrome. Retinoic acid syndrome. They have a whole disease, a group of symptoms that they call the retinoic acid syndrome. They call it that because it killed people. They gave it a name because people would start taking let's say all-trans retinoic acid is, when you see research and they mainly just say retinoic acid and they don't specifically say which one, they're typically talking about all-trans retinoic acid. All-trans retinoic acid, if you go and watch my other video, is made inside your body from vitamin A as well. All-trans retinoic acid, when we had veterans in a study applying it to their face, they stopped the study because too many of the veterans were dying early. Okay, they were absorbing it into their system. That's where it goes. Let's go on this. Let's just stick here for a second. Reversible symptomatic myocarditis. Myocarditis, inflammation of the heart muscle. The myo means muscle. Cardi means cardiac, heart, and is the cover of it. Myocardium, heart muscle covering. Myocarditis. Reversible means what they're saying is when they took away the all-trans retinoic acid, when they stopped giving it, the myocarditis went away. When you take away vitamin A, the problem went away? That's crazy. Huh, must be pretty toxic. The last one, this is the cherry on top. Acute myocardial infarction in a young woman on isotretinoin treatment. Do you know what an acute myocardial infarction is? It's a heart attack. The heart attacks usually happen to young people. Young woman on isotretinoin treatment. She's taking 13-cis retinoic acid and she got a heart attack. Is heart disease a problem today? Does a heart attack have to be a long built-up process, or could it happen within a treatment of a medication, within the duration of a treatment of medication? What if something's really toxic and you put in a lot of it at once? What if something's really toxic, but you only take a little bit of it over a long time? You get the same problem. Prostate cancer and liver cancer. Okay. Prostate cancer. Serum retinol and carotenoid concentrations and prostate cancer risk results from the prostate cancer prevention trial. Conclusion. This is a quote from the paper. Conclusion: in the placebo arm of the prospective study, high serum retinol and alpha carotene concentrations were associated with increased risk of total and high-grade prostate cancers. Impact: men with higher serum levels of serum retinol and alpha carotene may be at increased risk for prostate cancer. End quote. High serum retinol and alpha carotene concentrations were associated with increased risk of total prostate cancers and high-grade prostate cancers. I changed that just to say it specifically. Men with higher levels of serum retinol and alpha carotene may be at increased risk for prostate cancer. Are you out there trying to take more retinol because you think it's going to help your health, and maybe your health isn't going the way you want it? I can tell you, I didn't know about vitamin A toxicity when my dad got prostate cancer. In my mid-20s, I started developing urination problems that were consistent with prostate problems. In my mid-20s, and I used to take supplements. I used to try to eat healthy, quote unquote healthy, and eat lots of brightly colored foods and all that stuff. Tons of tomatoes. Oh man. If you haven't seen my articles on the nightshades, yeah, I used to be called Dr. Nightshade too, because I was kind of bringing the public's attention to nightshades. But I started developing prostate problems in my mid-20s. And now I'm in my mid-40s. My father passed because I didn't know how to help him back then. I have, in my mid-40s, none of those prostate problems anymore. None of those urination issues anymore, because I don't eat vitamin A anymore. Isn't that weird how this research and my experience and my dad's experience would line up? Liver cancer. Association of serum alpha tocopherol, beta carotene, and retinol with liver cancer incidence and chronic liver disease mortality. Here's the quote. Conclusions: our findings suggest that higher concentrations of beta carotene and retinol are associated with incident liver cancer and chronic liver disease. Higher concentrations of beta carotene and retinol are associated with incident liver cancer and chronic liver disease. So there's a saying called happy liver, happy life. Higher concentrations of beta carotene, which turns into retinaldehyde, which turns into retinol, can turn into retinol, are associated with higher rates of liver cancer, chronic liver disease, and prostate cancer. How good is that vitamin A for your immune system again? Maybe it's not. Diabetes and obesity, these were also mentioned. So diabetes, again, I have a link there that goes back to my research forum, then I have the study link. Association between oral isotretinoin therapy and unmasked latent immunomediated diabetes. Let me simplify that for you. There was a person who got put on isotretinoin, and by the end of it, they had diabetes. And the whole paper is trying to make an excuse that maybe this guy had some sort of latent or hidden diabetes that the isotretinoin brought to the surface. What a crock. Do you actually believe this stuff? He took isotretinoin, at the end of it, he had diabetes. Autoimmune diabetes. That's either type 1 or type 1.5. Okay? Then we get into obesity. Now, I have a whole video connecting the research on overweight and obesity to vitamin A in the body. Guess what? Higher serum retinol was associated with higher obesity. And then we have liver cancer, diabetes, prostate cancer. Wow. Isn't this modern life here? Isn't this what we deal with? Isn't this the health epidemic? You know, what's going on? Here's the paper. Assessment of indicators of vitamin A status in non-cirrhotic chronic hepatitis C patients. I picked this paper because it had the shortest quote. But like I said, I have a whole video on it. You should go check it out on my channel. Quote, overweight or obese patients had higher serum retinol levels than those with a normal body mass index, end quote. Moving on. Now people say, well, but I don't know that there's a real epidemic of vitamin A toxicity going on. Is it really going on? Is there a universal epidemic of vitamin A toxicity? So the quote from the book, the K2 book, this is the first book to reveal how universal a vitamin K2 deficiency is. Here's a paper on true diagnosable from a cadaver study. So they had people died, right? They got the cadavers okay to use in the study. They measured their blood vitamin A multiple ways, and they took a chunk of their liver and they analyzed it for vitamin A, because the vitamin A in the liver biopsy is the gold standard of vitamin A toxicity. And so that is why the studies I use to show how much vitamin A toxicity in the next slide or two is going on, I use the liver biopsy studies, the cadaver studies, because those are the gold standard. And they use people in these studies who died from like accidental causes and of natural causes or disease. They didn't just use people who died of disease. So there's not a ton of selection bias. They got people who died. Okay. Here's the paper for you US folks. You should pay attention, especially you ones who are trying to take cod liver oil or vitamin or liver supplements or vitamin A supplements or eat the rainbow. You should pay attention to this. And for those of you who are out there saying there's a vitamin A deficiency in our country, I'm going to ask you how these people got so toxic if there's such a deficiency. And they're measuring retinol esters in the liver. They're not measuring carotenoids. I heard some loony theory that carotenoids were preventing the conversion of retinol, and that's just somebody who doesn't understand vitamin A metabolism at all. Most people don't. Here's the paper. Serum retinol esters are positively correlated with analyzed total liver vitamin A reserves collected from US adults at time of death. Serum retinol esters, they're measuring retinol esters in the blood, are positively correlated with analyzed total liver vitamin A reserves. That's the liver biopsy, where they took a chunk from US adults at time of death. Here's the quotes from it. Cadaver liver samples were analyzed to explore vitamin A status biomarker associations in US adults. 9 subjects, 33% had hypervitaminosis A, which is defined as greater than or equal to 1 micromole of vitamin A per gram of liver. There was 27 total subjects in the study. 33% of them, 9 of the 27, had diagnosable hypervitaminosis A by the gold standard. On with the quote. The World Health Organization often uses a 20% prevalence to define a severe public health concern. Chronic vitamin A toxicity can occur from ingestion of moderate levels of preformed vitamin A for months or years. Moderate levels. That means high levels are guaranteed. Moderate levels can also cause you chronic vitamin A toxicity. Wait, did you listen to the time there? Months? Months? How long have you been taking that cod liver oil or that vitamin A supplement or that multivitamin? Or years? Months? That should scare the heck out of you. Last quote, the hypervitaminotic A concentrations discovered in these subjects would not have been identified by currently applied serum indicators. What they're saying is the vitamin A that they found in the liver showed that people were toxic, but that their blood measurements, serum retinol, which is if you go to your doctor and you say, doc, will you measure my blood vitamin A? Because I watched this video and I'm concerned about vitamin A toxicity. And they measure your serum retinol. What they're saying right here is that your blood retinol, your blood vitamin A, which is the main test, it's really the only test out there that most people are ever going to get. You can run retinol binding protein, but there's not as much research on it. Serum retinol is what you're going to get. They're saying that your serum retinol probably is not going to show that your liver is toxic. People say, why do we run it? I run it because I'm familiar with it and I have a good idea of what's going on. I probably have the most idea of what's going on because I actually treat people for this. And most people aren't toxic by serum retinol standards, but they've got all the vitamin A toxicity symptoms. And how do we know that they're vitamin A toxicity symptoms? Because they start reducing the vitamin A in their diet and doing the other things that are in my vitamin A detox program, and they start getting better. What other proof do we need? So let's just jump back up to this. World Health Organization uses a 20% prevalence to define a severe public health concern. They might use another word there, an epidemic. Well, 33% of the cadavers they tested had vitamin A toxicity in their liver. Severe public health concern, AKA maybe an epidemic. And they're saying in that book, they're saying vitamin K2 deficiency seems to be quite universal. Do you think meeting out of everybody you meet in a day, 1 out of 3 of them having vitamin A toxicity would seem kind of universal? I would, but we have more studies on vitamin A toxicity from cadaver liver samples. This next paper is not that. The next slide will be the more liver samples. So how much vitamin A toxicity is happening worldwide? From the paper, overlapping vitamin A interventions in the US, Guatemala, Zambia, and South Africa. Case studies. Okay. So this first part, I'm going to read it again, but it's the slide we just went over. Liver biopsies, the gold standard test from 27 US adult cadavers revealed a 33% prevalence of hypervitaminosis A, defined as greater than or equal to 1 micromole per gram of liver. 1 out of every 3 people being vitamin A toxic is an epidemic. Okay, so now let's move on to the other countries. In a study of 133 Zambian children, 59% were diagnosable with hypervitaminosis A, and 16% had more than 5% total serum vitamin A as retinol esters. That means they're above toxicity levels. So they were diagnosable with multiple methods. Once you have retinol esters spilling out of your blood, spilling out of your liver into your blood, and that gets too high, retinol esters in your blood are super toxic. Your body puts them as retinol esters into the liver because that's the way it stores them. It's the best approach the body has. But retinol esters, when you start seeing retinol esters rise in the blood, that means your liver is overflowing with them. It can't hold them. And so then they spill into the blood, and they're very toxic there. It only takes 5% of them in the blood. Most of the vitamin A in your blood is retinol. When retinol esters go too high in the blood, that's another way to diagnose vitamin A toxicity. So how many ways could we diagnose vitamin A toxicity? We could do it with a liver biopsy. Most people don't want to do that. I don't want to do that. You could do it with serum retinol. And I've seen people who are technically hypervitaminosis A on serum retinol, and those people are messed up. One guy was at a 70 in the US units, and he had 4 autoimmune diseases. I was not surprised. We're going to help him. So there's multiple ways of diagnosing vitamin A toxicity. There's by the liver, there's by the blood, multiple ways in the blood, but the most effective way is the liver biopsy. And most people aren't going to do that. Even the researchers say we can't do it because of ethical concerns. You can't just have somebody enter a study and then take a chunk of their liver. That's not how they do it. So now on to South Africa. In 40 South African children who frequently consumed liver, 72.5 of them had more than 5% total serum vitamin A as retinol esters. So in Zambia, in their group, 6 out of 10 kids were vitamin A toxic. In South Africa, 7 out of 10 kids were vitamin A toxic. Frequently consumed liver. Make sure you watch my liver, how eating liver causes death and disease video. But I thought vitamin A from animal foods was the natural form and it's what you need and it could never make you toxic. Somebody tell these kids that. Go tell the kids, okay? Because they shouldn't be toxic. So all 3 of these countries encourage high carotenoid consumption, eat a rainbow, have mandatory fortified foods with vitamin A. In the US, we do a lot of dairy. In Central and South America, they fortify their sugar, as an example. A high percent of supplement users or targeted supplementation to preschool children. So here's the problem, folks. We've encouraged high carotenoid consumption. We've fortified foods. We encourage eating high vitamin A foods that are just naturally that way. Dairy, eggs, liver, cod liver oil, fish oil. And then people are supplementing even more of it. Okay? This is why it's such a problem. And this is why nobody can see it, is because when you're so deep in it, you can't imagine, everybody's vitamin A toxic. How are you going to see it when everybody looks the same? So now we're going to go reviewing some past studies on vitamin A toxicity. And like I said, I go over these studies in more detail in another video about the epidemic of vitamin A toxicity. If you want to see that one, that has more detail than this one. So these studies, these are all gold standard liver biopsy studies of vitamin A levels in the liver tissue. Gold standard. These numbers are the percentages of subjects that were distinctly higher than currently accepted toxicity levels. So what I did with these papers, I took the current level, accepted level for toxicity, and I went back and I analyzed these papers, got all the units right, looked at how many people were toxic in these liver biopsy studies by today's standards, because they didn't have the standard back then. They couldn't say it, but they could give you the numbers. And now we can go back and look at them. Okay. In Singapore in 1988. Oh, sorry, let me go back one paper, two slides. The serum retinol esters are positively correlated with analyzed total liver vitamin A reserves collected from the US adults in time of death. I'm not remembering it off the top of my head, the year it was. I want to say it was either 2015 or 2018. So this is a recent study. Very recent, like within 5 years. Okay, I don't remember the year and I'm not going to click on it right now because it'll take me out of my slideshow. So now we're on to Singapore back in 1988. Remember, the World Health Organization said 20% prevalence is a severe public health concern. So in Singapore, 1988, Chinese Singaporeans, 19.1%, pretty close. Indian Singaporeans, 13.6%. Malaysian Singaporeans, 24%. Caucasian and Eurasian Singaporeans, 40%. Okay, so now we had some other papers on liver biopsy studies. So London, England, 1977, 31% toxic. Washington, D.C., 1973, 24.2% toxic. New York City back in 1970 was only 10%, but that's still 1 out of every 10 people vitamin A toxic. Are you serious? Ghana, Africa, 1967. This is the place where they're supplementing vitamin A like crazy. They're giving people gigantic pills of it, and they're saying they're all vitamin A deficient. 50% of the people were toxic. New Zealand, 1962, 27.9%. Almost all of those are severe public health concerns. No one's talking about it. So after all of that, do you seriously still believe that this is just correlation or just coincidence? Somehow I'm making a mistake in my interpretation of all this research, or is it maybe Kind of like back when doctors used to say cigarettes were good for you and they were okay to smoke. Maybe we've made a huge mistake and it's been 100 years that we haven't figured it out. So the moral of the story, what have we learned today? We have learned that vitamin A in multiple forms depletes vitamin K quite effectively. We have learned that higher levels or intakes of vitamin A have been shown to be correlated with all of the major diseases that have been correlated with vitamin K deficiency. So you might think, oh, I'll just take a bunch of vitamin K to fix it. Well, taking megadose vitamin K supplements might help relieve some of the symptoms of vitamin A toxicity. But fixing the actual root cause of your recurring vitamin K deficiency lies entirely in getting rid of your vitamin A toxicity. That is what I specialize in. With my nutritional restoration clients, I dose vitamin K2 supplements specifically based on calcium levels on a hair analysis, because hair analysis gives you over time the best view of what is going on with the calcium flow in the body. Blood tests, not as helpful on calcium. I use blood tests too. I use hair tests and blood tests to determine somebody's nutritional status. And I like to think I'm pretty good at it. Because we get to, here's the thing about blood tests and hair tests for people who want to sell you on one or the other. Certain practitioners like blood tests because it makes them feel more official, because other normal people can't just go out and order them most times. And the hair analysis people like to think that they hold some secret to the kingdom. They can't order blood tests, so they like to badmouth blood tests. We always want to use the right tool for the right job. If you can try to drive a screw in with a hammer, it's going to be really ugly and it's probably not going to work. You want to use the right tool for the right job. The hair test is great for a bunch of minerals, but not all of them. It's not good for iron, copper, and zinc. I use blood tests specifically for iron, copper, and zinc. And I actually combine the hair test and the blood test on copper and zinc specifically. So we get views at all angles of it because we need to see really what's going on in the body. But with that vitamin K supplementation based on the calcium on a hair test, I use it in the beginning with what I believe we need. And the eventual goal is not to need the supplement, because if we get rid of the vitamin A toxicity, then the vitamin K deficiency, poof, just disappears. Okay? If you want more information on how to fix your vitamin A toxicity, you're looking at the guy who can help you. My website for things like nutritional restoration, where I'm going to do individual work, is nutritionrestored.com. Other videos of mine can be found on YouTube at my Nutrition Restored channel. The link is there. I can be found at Nutrition Restored on BitChute. The link is there. On Facebook, my Facebook is Dr. as Teacher. You can find it. There's the link. And then the Vitamin A Toxicity and Detoxification Network, which we have at last count over 550 members, where we have a great community there of people helping each other, finding stuff to help people and relating their experiences and going through, and you get access to the do-it-yourself vitamin A detox program. It doesn't include the nutrient testing that I do for my nutritional restoration clients. That's the individual work. But if you wanted to get started on your own, this is where you could go. Hope you all enjoyed this presentation today. I enjoyed giving it and making it, and I will hopefully see you around. Go check out the other videos on my channel. Make sure to like and subscribe and hit the bell and all that stuff. Bye, everybody.